Hi everyone, my name is Sarah Zwint. I'm a sixth quarter student at Sherman.
Hi, my name is Aubrey Scotty. I'm a 10th quarter Sherman student, and we are a part of Zeta Phi Chi, which is a philosophy and professional organization on campus. And today we're going to have an interview with Dr. Grant Dennis. He's the owner of The Specific in Little Rock, Arkansas. And he's here to talk to us today about his technique, which is TATS, also known as the art of the specific. And he's going to talk to us about specific upper cervical knee chest work.
What's up, gals?
Hello. So what we kind of want to know, first of all, just talk to us about TATS. What do you guys do?
Yeah, so the art of the specific is knee, chest, upper cervical, solid headpiece training program. And, for a long time, I used to tell people that it's really a program for anybody that's in chiropractic, just to better understand what it is that we do as chiropractors, what makes us unique and distinct, and what it is that we should be doing in our offices for our patients. And sort of the evolution over the last year or two, we've sort of, Dr. Dill and myself, have focused a lot more on exclusively making the program for people who really want to learn the knee, chest, upper cervical specific work, and that work only. And, also within that, how to run a business doing that, how to command a fee doing that, how to manage people through care, what's the goal of care, why do we only adjust the upper two bones in the neck? I mean, there's just so many different questions that a lot of students and especially young aspiring docs have as it relates to, moving into practice. And so we really kind of organized the program in a way that it's really a lot more focused on that person that has an aspiration to want to practice knee, chest, upper cervical, or just upper cervical specific care. There's a lot of misconceptions out there and a lot of people that think they practice upper cervical specific care when they really, in fact, don't. By definition, upper cervical means just the upper two bones in the neck, which means that's primarily what you only specialize in. And so we just realized there was a lot of upper cervical training programs out there that really were sort of a shake on the upper cervical spine with a little bit of an emphasis in the rest of the spine as well. And so we really wanted to create an atmosphere where the doc who's aspiring to want to be a super highly successful upper cervical doc, and more importantly in a cash environment, we set up a program that is specifically designed to help those students and docs achieve that and practice with more certainty and more mastery.
Okay. What is your role in TATS? What is it that you do exactly?
This is also yerba mate, the official drink of Dr. Grant Dennis. All natural and organic, tea, caffeine-based. So I'm officially endorsing yerba mate. So I think your question was, what is my role? So my role is a co-instructor. Dr. Sean Dill and myself both teach. Obviously Dr. Dill founded the actual technique program alongside Dr. Andy Roberts, who's since passed, obviously, within the last, I think maybe 4 to 5 years now, going on 5 years actually, yeah. And so the technique is sort of an evolution from BJ Palmer's work of the knee, chest, early on upper cervical work, and it's over time kind of been passed down through various interns who worked under BJ. So there was Bud Crowder specifically, who sort of pioneered the knee chest work from BJ. And then under Bud Crowder, Andy Roberts was an intern under Bud Crowder. And so he sort of took his work and brought it down. And then Dr. Dill learned under the Kale system and the Tuscarino and the Amalo system and sort of took that work and meshed it into what is the art of the specific today, which is an advancement with what we understand in the science and in the philosophy and in the art of chiropractic. We just took, and a lot of upper cervical camps will tell you they practice the same way BJ does, or we do it like BJ did. And I'm just here to tell you that I think that's a slap directly in BJ's face, because BJ would be like, if you're doing it the same way I did it in 1930, what the heck have you done over the last 100 years to advance this thing that I've dedicated my life to, right? So we sort of take the spin that, with more information and more technology and more research available to us, I would hope that we're doing it a little bit better than we did in 1935. So, in answering what's my role, it's really just as sort of a moderator. I'm a student myself. I mean, BJ always says you should always be a student first. And so I take the same seat, in the course, that the docs and the students do. And so I'm always looking to advance and become better, but somebody has to start the conversation, right? And somebody has to have some sort of understanding with which we learn from. And so, Dr. Dill, I would say, is more of our Yoda, whereas I'm more of the, Obi-Wan Kenobi in between the Luke Skywalker, right? I don't know if that's a good analogy or not, but Basically, if you were to say what's my, it's probably co-instructor, co-moderator, and conversation starter.
Conversation starter.
So since you mentioned BJ and the Green Books, that being said, what role does philosophy and the Green Books play in this technique, in any technique?
Yeah, it's a great question. I wish people would ask that question more. It's sort of, I would say that the Green Books sort of offer the same importance in our philosophy and our understanding of chiropractic as the Constitution does to the United States of America, right? Like, in order for you to form a law, in order for you to govern a country, you have to have some sort of document that understates and sort of lays out the plan for what is and what isn't okay, right? So there's laws, there's things with which the country was founded on that you always sort of lean back to. And if you look at anything in politics, the number one thing they're always going to revert back to is the Constitution. And when anything is brought up, right, whether it's an impeachment, a pandemic, doesn't matter, you're always going to revert back to what's constitutional or not, right? Because that is what is accepted as your governing law, right? Well, the Green Books for us are the same thing in chiropractic. It's anytime there's a question that's brought up, you're going to go back to the people who founded the profession and what they denote as what is or what isn't something. What is truth? What's not? What's chiropractic? What isn't? I mean, it's clearly stated in all the Green Books. My two personal favorites are the Chiropractic Textbook, Volume 14. It specifically states in the freshman, sophomore, junior, and senior text what is chiropractic and what isn't, right? And so the people who founded the profession said, hey, so there's going to be these bobo heads that come along and say this is chiropractic, and in this text right here, clearly I'm going to show you that it's not, right? And so, what I would say is it's paramount. I mean, without it, you really can't have a conversation with somebody, which is where I struggle a lot when people ask me, well, is stem cell therapy chiropractic? And I'm like, well, by definition of what's in the Green Books, it's not. But you don't, if you've never read the Green Books, whereas you've never read the Constitution, you don't know what truth is aside from truth from false, right? So you have to have some sort of level playing ground with which we both can agree that we are going to look at this from the standpoint that we assume the Green Books is our Constitution for chiropractic, right? So if you can agree with me on that, then we can have a conversation. But if you don't agree with me on that, we can't possibly have a productive, deductive conversation on assuming anything to be truth in chiropractic, and therefore there is no growth, right? And so I would say they're the most paramount, thing we have in order to establish our techniques, our business systems, anything we do within chiropractic. You have to look at it from the lens through a Green Book because somebody came before you, right? And so, there are people who are jailed for chiropractic, people who lost their life protecting what it is that we get to do every single day. And so I don't take that lightly. I wish more chiropractors didn't take that lightly. I wish more read the Green Books, but now you get this whole movement and this forward thinking, right? Of we don't need Green Books, and it's all outdated, and the subluxation's outdated, pseudoscience. And I just presented at Lyceum over this past weekend for 2 hours on trying to debunk the bobo heads who say that. Like, you're just blind to an eye. First off, A, I've never read a Green Book. Second, don't know how to apply it, and third, don't know how to research. So you take some other dude over here that you just, like CNN or Fox News or somebody told you something, right? And you just assumed it to be truth and went, oh yeah, I'm going to jump on the forward thinking bandwagon until someone goes, so have you ever read volume 14, the chiropractic textbook? And they're like, no. And I'm like, well, then how can you even be a chiropractor? A. B, how could you even, begin to follow some sort of movement, not even knowing what the premise it was built on, right? And so I don't know if it's just a loss of critical thinking in our profession or what, but I always thought that, in freshman year of chiropractic college, and Sherman's the only one I know of currently that does it, you should be introduced to a Green Book. You should read it, and you should begin to understand, what your basic level philosophy and understanding and definitions are before you can dig deeper on them.
So when you were a student, what kind of exposure did you get to Green Books / other than the chiropractic textbook, what do you think students should be applying through in school from the philosophy standpoint?
Yeah, so I actually, shamefully will say I went to Parker University, which is sort of part of this forward movement thinking initiative, I guess now, where it's like we're just going to throw all Green Books out the door and practice CrossFit practice chiropractic out of CrossFit boxes and all types of different wacky jack thinking. But I actually was exposed to a Green Book on my own volition by searching out. I thought, if I'm going to graduate tomorrow and go charge a fee for a service for something that I do, I would say that in Tri-4 currently where I was in Parker, I was like, my service would be worth about $5 because I don't know how I'm actually helping people. I can't lay my head on the pillow at night and know from a place of integrity helping people and charging them for this, right? And so I was like, I want to have a better understanding and a better level of certainty, and I want to see sick people, and I want to command a high fee to do that. And so I reached out to a couple mentors. They said, you need to get hooked up with Dr. Andy Roberts and Dr. Sean Dill. I came into the very same program I teach as a student, which is one of my favorite things about it is I got to see the side of a student side before I was a teacher side, right? And so I came in as a student strictly asking questions, like asking all sorts of questions. You know, how do I know my patient needs this? How do I know when they don't need this correction? How do I know I'm actually helping this person? How do I know when they hit my door, they're better than when they came in? Like there were so many different questions I had, right? That I searched through the green books. I started discovering that a large majority of the really sick cases got better from upper cervical, which then led me down the road of, well, why is that the case? And then I saw that all the research that was done in chiropractic was all upper cervical research. And I'm like, okay, so maybe there's this thing to upper cervical. Maybe I should learn that first. So then I started going into volume 18, which is honestly one of the books I would say, one of two, that if you're a student, you should dig into. Number one, obviously the chiropractic textbook, that's volume 14. If you're going to be a chiropractor, you should read the chiropractic textbook. In fact, that's one of my favorite questions I like to ask my patients sometimes who have been with me for a long time. I'll say, hey, so this is the chiropractic textbook. Do you think chiropractors should have read that? And they're like, well, yeah, duh. And I'm like, I think it's funny because like less than 15% have probably actually read this. They're like, what? Well, that's stupid. And I'm like, yeah, no, I think so too. The second one is volume 18. Especially if you want to practice upper cervical. That's BJ's sort of expose on all his thoughts related to upper cervical care, specific upper cervical care. And then the third one is Palmer's Law of Life. I think you should read Palmer's Law of Life. That's a super good one. Just understanding the laws and how the universe works and how it reciprocates you based on the work you put in. And it's I don't want to say karma, but there's a lot of different things in Palmer's Law of Life that are super awesome for a student to read to help them understand that what the time and the efforts and the resources you're putting in now are going to come back tenfold on the other side of it if you do it right, just based on Palmer's Law of Life and the way that we should look at life. And then I think I just recently put you, Sarah, onto the little excerpt in the back of volume 14, which is funny to me because it's there, but unless you have read volume 14, you wouldn't know it's there. But Galen Price in the very, very back, there's a small excerpt in the back of volume 14, which is called the Occipital-Atlanto-Axial region, where Galen Price literally goes, oh, hey, so here's the chiropractic textbook. Oh, hey, and wait, there's also this little emphasis on this upper cervical region that's kind of important in the very, very back. But I think it's funny, and I think it purposely was put in the back because I think he was like, I don't actually want you to read this unless you've read the full 90% of it to enjoy the last 10% of it. And so most people don't even know it's there. And when I show it to people, they're like, especially chiropractors, they're like, well, I didn't even know that was there. I'm like, yeah, well, A, tells me you didn't read it. B, tells me you definitely should read it now that you know it's there. But those are the 3 to 4. I know you asked for 2, but I'm kind of a glass half empty type of guy. If you ask for 2, I'm probably going to give you 4.
That's interesting you mentioned that last little insert because just before this call, I was like, Aubrey, did I tell you what you and I talked about last week? And then when you and I talked last week, I shared a photo of that last little chapter on Instagram, and 2 or 3 different people messaged me. They're like, where did you find that? And I was like, now blow your mind for a second. Open up the link. I know you have. Yeah.
Dr.
The greatest. Yep. Go ahead.
Sorry. If you have a closing comment on that question, I was going to ask another question, so you might want to finish up.
Go ahead. No, go ahead.
Okay. Can you talk to us about the analysis of TATS and how it may differ from other upper cervical techniques?
Yeah, that's a great question too. First off, I just want to reiterate that upper cervical is just a highway. Upper cervical is just, a pathway that you're taking to get to point A to point B for a patient. And, Aubrey, I know you know this, but, we talk about this a lot in TATS, is that upper cervical literally is just the highway that you're driving on. What particular car you get to drive down that highway in is up to you. I would like to think that at the basic level of upper cervical, we're all trying to get our patients from point A to point B on the same highway. We're just going to use a little bit of a different vehicle to get us there, right? And so, whether it's Blair, whether it's AO, whether it's Epic, I'm familiar with all these techniques. We all are getting results in our clinics, right? Well, the reason for that is because we all have a similar philosophy, and we all definitely have probably exact same rationale. When it comes to TATS, I think what makes us unique a little bit is really, I think that you should always look at your approach to technique through some sort of philosophical lens, right? And so for us, we choose to think that the biomechanical disafferentation theory is what is validating the results we're seeing in our office, okay? So if you're going to make that statement, which by the way, if you look at a lot of upper cervical research, that's the premise that most of them will state, is that the reason we think that we're seeing this result with this patient is based on the biomechanical disafferentation theory. Well, it's interesting because the biomechanical disafferentation theory has the word biomechanical. It's not the misafferentation, the misalignment disafferentation theory. It's not the bone out of place disafferentation theory. It's the biomechanical disafferentation theory because it's based off the premise that there's a biomechanical issue in the upper cervical spine. So really, one of the biggest things that delineates us is we look at things through a biomechanical or a motion x-ray lens. So we want to see when we elicit motion into the upper cervical spine. So we like to take lateral flexion APOMs, just like you're seeing me do right now, so that we can actually look at what we assume to be normal biomechanics, and then therefore we can pick out abnormal. That particular analysis is going to lend really well to people who are very aesthetic learners. So they're visual. They want to actually see visualization and structures that move in an abnormal or normal way. If you're a very analytical person, then you're going to like the 90-90 measurements down to the degree and that sort of thing. And that may be more of your style. But based on a lot of the things we're seeing in upper cervical research now, we're seeing there's a lot of asymmetries that occur in the upper cervical spine. So, over 50% of the time, the C2 den sits off center of C2 body, which means if you're drawing static lines, over half the time, the line you're drawing down perpendicular is 50% of the time wrong. And so, we know that based on research. So for us to know that and then continue to do that, in our opinion, is not scientific. It's not wise. It's out of integrity based on what it is we know to be true, right? And so I think BJ would agree in that aspect. So we should always be evolving, right? And so for us, the biomechanical analysis of X-ray is unique to us. And so, I actually did a research article or a research paper, and I presented at IRAPS last year looking at the inter-examiner reliability of that particular analysis, and we found it to be 80%. Among about 30 practitioners. So what it tells us is we're always looking for a way to be more specific and more scientific, and more importantly, more reproducible, right? And so BJ's the specific work, which is kind of like today's wellness or today's upper cervical. It's a buzzword, right? Like the specific, literally my clinic is the specific chiropractic center. Like the reason for that is because BJ's entire life work was dedicated to locating the specific cause for all disease, but more importantly, the specific cause that's reproducible from practitioner to practitioner. In other words, I should be able to reproduce it with each practitioner. I should be able to teach it to the next 3 generations and them all come up with the same specific analysis and get the same sick person well, right? So really what it boils down to is how can we become more specific and more reproducible from practitioner to practitioner, which is why our gold standard is thermography, because the inter-examiner reliability is over 90%. Currently, we use the biomechanical model because not only it represents our rationale, but it also is very specific and it's also very reliable among practitioner to practitioner if you've been trained in that way of looking at things. And so, I just think that it matches our philosophy and our rationale better. I think it's more specific and reliable. It is an extra level of, and I think Aubrey would agree, it's very difficult when you're first looking at these. It's difficult to take these x-rays. It's difficult to, to look at them and analyze them and come up with a potential primary, secondary, and tertiary listing. We know that there's over 274 different ways the upper cervical spine can subluxate and misalign. And so if you look at it from that standpoint, a lot of people will say, well, it's 2 bones, 2 sides. How hard could it be? It's actually very difficult. And so it lends itself to a unique brain and a unique mind and someone who wants to be challenged. And that's why, honestly, less than 1% of chiropractors are upper cervical chiropractors, because the work's very hard. I have patients that ask me that all the time. Well, how come there's not more docs that do that? And I say, well, do you see how hard it is me telling you don't need an adjustment today when you don't need an adjustment today? And do you see how hard it is me taking these x-rays and knowing where to start and how to adjust you and how to manage you through care? And it's very difficult, and especially when you're charging a cash fee and people are paying a high premium for your fee, it kind of ups the ante, when you're charging $95 a visit cash to somebody. It really puts a little extra pressure on you as a doc, to really, step up to the plate for somebody. But if you've been trained in the right way and you understand why you're worth that fee, it's because you can look at things the way that nobody else can look at things. And for us, it's the biomechanical x-ray analysis and the thermographic analysis. Then you begin to understand that, really what sets us apart is really trying to get the doc who understands that really what you're charging at, let's just say $95 a visit, is probably a quarter of what actually you're actually giving to somebody is. When you're talking about relieving somebody's, chronic life-changing migraines or fibromyalgia or Parkinson's or, all these cases we love to see, what's that worth to that person, and the fee you charge for that, they're actually willing to pay 10 times over that. But again, it's because what's in your brain and what that nobody else knows is what really shows up for them and delivers the goods.
Dang, I don't even know how to follow that. Okay, take it away.
What advice do you have for students that are still undecided on technique?
And
what advice do you have for students that maybe find themselves going down the path of upper cervical? What's that next step?
Right.
Yeah. So you said like what techniques should they be exploring and like what should their path look like as far as that goes? Yeah. So I think each person first and foremost should have a little bit of a different path. I always thought too, like the person who kind of sits back and at first glance says, well, man, there's no way I could just practice upper cervical. Like that's just not realistic. I actually think you're probably one of the people who should then, because you should at first always question it. The person who's like, oh, I definitely, without a shadow of a doubt, I know I want to practice knee, chest, upper cervical without ever having any sort of journey to that. That's the person that usually within year 1 or 2 of practice is like, yeah, I'm going to go back to activator and sacrums, which I have no problem with that. I'm just saying like, they're usually the ones that revert back because they didn't have the journey of difficulty to get there, right? Like they didn't go up the elevator to floor 1, 2, and 3 before they got to see the beautiful view at level 20. So, what I would say is in school, one of the first things you need to do is understand first and foremost what chiropractic is and what it isn't, which is the detection, location, and analysis of vertebral subluxation. Okay, so once we can agree on that's chiropractic, which there's where your typical lines of delineation are going to occur, because there's going to be others that say, well, subluxate what? So they're lost anyway, right? So, but once they can agree to the premise of detecting and locating subluxation, then what you can begin to do is look at the different techniques. And honestly, I think you need to have exposure to all of them at what are their specific analytical and objective measures they look to locate it, first and foremost, when it's present. B, when it's not present. In other words, you delivered an adjustment, it's no longer present based on those indicators. And C is the most important one, which is when patients come back, what are the objective indicators I'm looking at to know when they don't need to be adjusted, right? And so, Gonstead is very, very good at nervoscope, static, motion. There's an analytical way of looking at the full spine, right? And so you need to have exposure to that and understand what it is. Whether it's, diversified, I would make the argument it's not an actual analysis. It's actually more of a therapy. It's more of a stick the unstuck joints, increase range of motion, decrease pain, right? And so that really and truly fits more in a physical therapy model, but that's a story for another day. But you need to sort of have exposure to that to understand what it is and how it's different. There's a lot of different ones, right? But I truly think as a student, you need to explore them all. You need to figure out first and foremost, before any of that, is this analysis looking for subluxation and the removal therefore of. And then I was telling Sarah this the other day, I think the biggest thing too is you need to figure out the type of people you want to serve. I think, through school, especially through your clinicals, you need to begin to, as you start to take care of people, figure out like who are the type of people I really enjoy working with. Who are the, what are the types of conditions? If you're someone who wants to see pregnant moms, right? Then upper cervical can be a great route. If you want to, and you just need to look at like, what are the different ways that I can begin to treat this patient that I want to take care of and invite them into my office. In other words, if they're let's say you want to treat a very analytical person, which is people that I actually enjoy taking care of, people who are analytical. They want me to break down the scans for them. They want me to break down the x-rays for them. They want me to show them things in detail. And it's because they've been to a gajillion chiropractors usually by the time they get to me. So they don't trust anything you say when they first walk in, because they're like, dude, I've been burned like 10 times by this dude that's cranked on me from everywhere. And I'm like, and I'm going to adjust one spot and not every visit and potentially fix your issue. Right. And he's like, oh, hold up. I'm going to have to break this whole thing down. I actually enjoy working with people like that, but I also enjoy working with Joe Schmo, who's like, dude, I don't even care as long as it works. Right. And so upper cervical can fit in both those models, and, especially my particular analysis. But, I think that with technique, you need to see them all in order to appreciate them all. You need to, in order to have a conversation about the differences, you can't begin to talk about, even in your own head, the differences without a basic understanding of them all, right? Like Blair versus knee chest. Like, well, I was talking to a doctor the other day and he's like, why do you guys choose to adjust in the knee chest posture versus the side posture? because BJ later on in his life, decided to go to the side posture. I was like, well, BJ's not around for us to ask, but how do we not know that BJ maybe was just short and his back started hurting and wanted to adjust this way instead of the other way? Like, right? You don't know, you know what I mean? So for me, I have a rationale. I can't speak to BJ's rationale, but for me and my patients, I see clinical outcomes that are super great with this type of adjusting. And so it doesn't mean that the other one is negative. It just works best for me, my body type, people I take care of. And so these are things it's going to take a full, round of school experience. That's why school is as long as it is. And that's why they offer as many techniques as they do. But really you have to, and this is really at its basic level. When you talk about technique, the number one question you be asking yourself is, do you want to see the sick? So if there's a patient in your town that literally is sick, dying, has been everywhere, nothing has worked, do you want to be the person to see that patient? Because if you do, then that's going to mean you're going to go to an extra level of analysis that nobody actually has had. You have to be up here with your analysis and the way you look at things, because that patient's probably already seen a diversified guy. A lot of diversified guys. Probably already seen a Gonstead guy. It's probably already seen a diverse, or just an activator person, right? Or the ART doc, or the chiro who does the roller table. I mean, he's seen all that. There's a bunch of those, What they haven't seen is someone who just looks at it through an upper cervical lens, which for them is like, I haven't ever tried that. What do I have to lose? And that's the patient that I want coming into my office. And then my technique's going to match that. If you're someone that's like, hey, dude, I really enjoy working with athletes and rubbing hamstrings out, then yeah, you're not going to choose upper cervical, right? You're going to completely go a different technique route, and that's okay too. I would just hope that you would adjust subluxation and then do the ART. But if not, you just wasted a whole lot of money, and you could have went to 2 years less of school to go be a PT. So, when you talk about technique journeys, I think everyone should be different, but at its basic level, really, it's just, do you want to see super sick people, or do you just want to see the run of the mill people? High volume, low fee. I could go off on that. Like, do you want to be low volume, high fee? Do you want to be high volume, low fee? Both are okay. I just choose to take really, really great care of less people who charge a premium. I just would like to see, I still see volume, but not relative to like 300 people, a day, but it's just, that's not my jam. So that's another thing you always want to look at. People are ringing off the hook.
Yeah, that's super encouraging to someone like me, because I'm at that, like you and I spoke last week, I'm at that point where I want to start diving into more, like I've explored a lot of different things, and I'm like, upper cervical and knee chest, upper cervical in particular, is so intriguing to me. So on that note, and kind of to close out, if people want to learn more about TATS in particular, where can they learn more?
Yeah, so you can just reach out to me at grant@thespecific.com, grant@thespecific.com, or you can just go to drgrantdentist.com. You can reach out and set up a time to chat with me about it. We really only work with, kind of like I was saying earlier, we're only working with 30 people this year. So 20 students, 10 docs max. The reason for that is we're using the same philosophy in our teachings we do in our clinics, which is, I want to work with the hyper-focused. I don't want to work with the dude who's trying, or the gal that's trying to, have a little upper cervical tool in their tool belt. Like, there's plenty of programs for that. But if you want to learn, like, hey, do I want to really know what it looks like to charge a $3,500 care plan and give, a chick with debilitating migraine results who's been everywhere and is having Botox injections, committed suicide twice, like, or at least attempted that, right? Like, then this is what the program's focused for, is someone who's in that mindset. But yeah, you can reach out to me, grant@thespecific.com, drgrantdentist.com, or you can just go to the Art of the Specific Facebook page and shoot us a DM or a message, and I can get back to you that way. Secondly, people should also support Zeta. So I'm just going to put a plug out there for the Zetas. I've given some donations to Zetas in the past. I probably will again for today. I know you guys are principled, subluxation based, doing right things for the profession. So thank you for actually contributing to our own, progress and not our own demise, and kind of giving people a good fertile ground to go and learn how to actually, create the lifestyle of your dreams practicing chiropractic.
Amen to that. And we super appreciate that. And we
Thank you.
appreciate your time today as well. Because we could all just keep talking for the rest of the entire obviously. Yeah.
And I appreciate you guys having me on. It's been fun. And like I said, one of my biggest passions is just being a resource to students and young docs. I know what it was like to be a student. Wasn't long ago. I know what it's like to be a first doc out in practice. I know what it's like to be doc in 5th year. I don't know what it looks like to be that 35th year in practice yet. I'm sure at some point I will. Hopefully, that's the biggest thing I like to tell people, is hopefully the best things in life that you've ever done you haven't done yet. And so, I just like to be a resource for students in whatever way I can, whether it's just answering technique questions, chiropractic questions, business questions. And if I don't have the answer to a question, I certainly will always say that too. And I will try to find somebody who does. Got a pretty good circle of docs who love chiropractic. Also, if you're a student, join the IFCO, the International Federation of Chiropractors and Organizations. Students, reach out to me if you want to join. It's $50 to join while you're in school. Support you the whole entire time you're in school. Should all be supporting that organization as well. Support the organizations that support you, Zetas, IFCO, whatever student technique club you're in. And of course, you're joining and supporting the greatest education system in the world, which is Sherman College of Chiropractic currently. So I'm speaking to the choir on that one. But I appreciate you guys this time. You guys did awesome.
Appreciate you. Thank you.
Thank you for your time, Dr. Dennis.
We just killed that.
Yeah.
Woo! Okay.
And he's going to be talking to us. I can't.
You were doing so great.
Why do I do that?
You have to show you have to get these on the bloopers.